to your health. Too much alcohol, uncontrolled sleep apnea, excess weight. These risk factors are some of the reasons 1 in 22 people have arterial fibrillation.
Yes, February is Heart Health Month, so we want you to know some surprising facts about AFib. Health reporter Haley Hernandez explains.
Most people aren't aware of the symptoms, especially if they're otherwise healthy, because they don't know that AFib can affect anyone. You might experience fatigue, palpitations, or even shortness of breath, but some people don't even feel that. AFib is a type of irregular heartbeat that can lead to serious health issues. You might think it only affects older people or unhealthy people, but guess what? It can happen to anyone at any age, healthy or not.
That occurs particularly after indulgence in excessive alcohol or poor diet. And this can cause the heart to race. And unfortunately, people, if they have that and it doesn't resolve, they can end up in the emergency room. Sometimes it goes away by itself and can reoccur in the future.
I like the drop shot.
Michael Copley could volley for hours. So when he started to get winded just going up a flight of stairs, that was his first sign he had AFib.
I took my pulse and it was fast. And so that was something new for me.
So what's the danger in actually having it?
It's a major risk factor for stroke. With patients who have atrial fibrillation, blood clots can form inside the heart that can break off and go to the brain and cause a stroke. These strokes are very debilitating, and it's thought that about 20% of strokes in the United States are caused by atrial fibrillation.
So if you're diagnosed, it's essential to follow your doctor's advice and get treated.
Managing your blood pressure, managing your weight, sleep patterns, sleep apnea. Reduction in alcohol use, particularly binge drinking, is going to reduce their episodes of atrial fibrillation. In the last 20 years, there have been a number of amazing minimally invasive procedures that can be used to treat atrial fibrillation.
Ablations like this Farapulse procedure that Michael had done uses signals to zap the heart cells back into rhythm. A year after the procedure, Michael is back on the court, AFib-free. In addition to increasing your chance of stroke, AFib causes a stress on the heart that progressively gets worse over time. Dr. Sharma says when patients start having more and more episodes of atrial fibrillation, it can weaken the heart muscle and contribute to congestive heart failure. I'm health reporter Haley Hernandez, KPRC 2 News.